Stephanie Bell-Flint joins us now to talk about video-assisted lung cancer surgery.
Thank you, Maggie. Joining us is thoracic surgeon Dr. Michael Koury, who is over at VATS Medical Center. Thank you for joining us.
Thank you.
Tell us a little bit about lung cancer in Mississippi. I would expect that we have high numbers.
We do. A lot of people in the state smoke, and in fact, a lot of people don't know this, but lung cancer kills more people in the United States than colon, breast, and prostate combined.
Wow.
So it's a huge problem that we see, and working very hard to try to alleviate the effects of it.
Now, tell us about some of the treatments. When someone comes to you and you find the lung cancer, what happens next?
Well, Maggie, first of all, you have to look at each patient and you have to determine what's their best treatment. A lot of how lung cancer is treated is based on the stage of the cancer, how big it is, where it's located, lymph node status. So you have to look at all that. People that smoke have other health issues as well, so you have to make sure that the patient can tolerate the procedures. But there's usually a multimodality approach with surgery, radiation, chemo, one or of each or all of the above. If a patient is a candidate for the surgery, the best treatment for lung cancer in the United States is to have it removed.
And what about secondhand smoke? If you get lung cancer that way, is it the same?
Same treatments. 90% of the time, lung cancer is secondary to smoking, but I have seen people that have never smoked. 10 or 15% of my practice are people that have never smoked that may have been around secondhand smoke. And there's actually some relationships within families that people can get lung cancer without smoking.
So the secondhand smoke studies that we see coming out aren't just blowing smoke, so to speak.
There's more and more data nowadays to show that there may be something to it. It's not as definitive as people that smoke or people that work around asbestos or that kind of thing, but it certainly could be something to it.
You were talking about a new technique, the video-assisted lobectomy. Did I say that right?
Yes, you did. It's called VATS, or video-assisted thoracic surgery. And the treatment that has been a standard for several decades now has been to go in and take out part of the lung through a 6 to 8 inch incision. You spread the ribs. Nowadays, because there's been an explosion in minimally invasive techniques over the past 2 decades in all types of surgical modalities, we've adapted some of those techniques to use for lung cancer, and we're able to take patients that need the surgery, and for the earlier stages, and that's where we hope to find all of them, is to take them in through 3 small incisions without any rib spreading, which really is kind of the culprit in the bigger operation for discomfort, and usually do their surgery in their home on the 3rd or 4th day. They have much less discomfort associated with the surgery than with the larger one, and they're able to get back to their activities within a couple of weeks.
I would think if you're going to do radiation or chemo after that, that would also make it easier to transition into that, not having to recover from a cracked chest.
That's absolutely the truth, and there's been plenty of studies to show if you have someone that's had the larger operation, thoracotomy, which some people still need, there's still a place for it. They may be 2 or 3 months before they can get to what's the adjuvant therapy of the chemo, the radiation therapy, where with the VATS lobectomy, those people might be able to be treated within 3 to 4 weeks.
Now let's talk about screening. When should you be screened? Who should be screened?
Well, anybody that smokes, and especially if you smoke a pack a day for 10 or 15 years, you ought to consider that. There have been a lot of studies that show that just doing a chest x-ray is not enough. If you've got a history in your family, or if you're a smoker, there's really, the NIH, the National Institutes of Health, recently came out with a study showing that the best treatment is or the best screening study is to get a CT scan of the chest. And in fact, when they compared chest x-rays to CT scans, those people had a 20% better survival rate than people with just CT scans. So if you do smoke, or you're worried about it, especially if you're 40 or 50 or so and you smoked for a long time, you need to talk to your doctor about getting a CT scan. And some people that don't have doctors, the Baptist offers spiral CT scanning screening. You can just call our number at 601-948-6262, and we'll be happy to have someone arrange that and then help you with the follow-up of that.
All right, Dr. Michael Koury with
Fantastic.
Baptist Medical Center. Thank you so much, and you know, it's good to know that there are new procedures too.
Thank you for having me.
All right, and if you'd like more health news, you can log on to our website, WLBT.com, and click on Medical Matters.